The year is 1961. The Cold War chills the world. Deep in the vast, icy wilderness of Antarctica, a team of Soviet scientists faces a different kind of chill. They are completely isolated. Their research station, Novolazarevskaya, is their only sanctuary. Among them is Dr. Leonid Rogozov, a young, capable surgeon. He is responsible for the health and well-being of the entire team. But fate, it seems, has a cruel joke to play. Rogozov falls ill. The symptoms are unmistakable: nausea, sharp, stabbing pain in his lower abdomen. He knows the terrifying truth: appendicitis, a potentially deadly condition. In any other circumstance, a routine operation. But here, at the bottom of the world, there are no other doctors, no hospitals, no hope of evacuation. Just the biting Antarctic wind howling outside. Rogozov faces an impossible choice: wait for the almost inevitable, a ruptured appendix, certain death, or attempt the unthinkable, operate on himself. With only the station's meteorologist, a mechanic, and a few scientists as his assistants. Armed with a mirror and sheer determination, he makes his decision. He must become both doctor and patient. His life depends on it. Ends. The appendix, a small finger-shaped pouch. It protrudes from the cecum, the beginning of the large intestine. For years, its purpose remained a mystery, a seemingly useless evolutionary leftover, but its size belies its potential for danger. Appendicitis, a word that strikes fear. It is the inflammation of this little organ, a common surgical emergency. The usual culprit? Obstruction, a blockage at the appendix opening. This is often caused by a small hardened piece of stool, known as an appendicolith. Like a cork in a bottle, it traps bacteria inside the appendix. Other culprits include inflammation from viral or parasitic infections. Even swollen lymph nodes in the abdomen can lead to appendicitis by compressing the appendix. This blockage sets off a dangerous chain reaction. Pressure builds within the appendix. Bacteria multiply rapidly. Inflammation sets in. The appendix swells like an overfilled balloon. Left untreated, this can have dire consequences. Appendicitis announces itself with a symphony of pain. It typically begins near the belly button, a dull, cramping sensation. As hours pass, the pain intensifies. It migrates lower, settling in the right lower abdomen. Tenderness develops. A light touch feels like a punch. Nausea and vomiting often follow. The patient becomes feverish, their pulse races. A clear sign that something is terribly wrong. The real danger lies in what happens next. As the inflammation worsens, the appendix can rupture. This is a life-threatening complication. The contents of the appendix, now a toxic cocktail of bacteria and pus, spill into the abdominal cavity. This leads to peritonitis, a serious infection of the lining of the abdomen. Sepsis, a body-wide inflammatory response, can follow. Without prompt medical attention, it can be fatal. Thankfully, modern medicine offers a lifeline. Appendectomy, the surgical removal of the appendix, a routine procedure with a high success rate. Gone are the days of large incisions and lengthy recoveries. Laparoscopic appendectomy, using small incisions and a tiny camera, is now the gold standard. It allows for quicker recovery, less pain, and minimal scarring. Antibiotics are also crucial, both before and after surgery, to combat infection. For years, the appendix was dismissed as a useless evolutionary relic, a vestige of our herbivorous ancestors. But recent research suggests otherwise. The appendix, it seems, may play a role in our immune system. It may serve as a safe house for beneficial gut bacteria, a reservoir that can repopulate the gut after illness. Studies have shown that the appendix contains a high concentration of lymphoid tissue. This tissue is crucial for immune function. It helps to fight off infection. The appendix may also play a role in training the immune system early in life, exposing it to different types of bacteria. While the appendix is not essential for survival, its potential role in our health is becoming clearer. Perhaps it is not just a useless evolutionary remnant, but an organ with a purpose, even if that purpose is not yet fully understood. Whatever its function, one thing is certain: when the appendix goes rogue, the consequences can be dire.